this week's episode of Meet Somebody, everybody, we have a really special guest this week, Dr. Alex King. He's a new OMM doctor with us at Rowan SOM. Thanks for coming on.
Thanks for having me, guys. I'm excited to be here. Have a little combo.
Hey, Dr. All right. So when did you're a new faculty. So when did you start here at Rowan?
I joined about 5 weeks ago, so early March. I applied like in December because I was in private practice and I felt somewhat, you know, a little bit isolated in terms of my interaction with really other practitioners. It was myself and another doc, and I wanted to teach again. I wanted to be around students and be in a big kind of multidisciplinary center. So, of course, I was in Cherry Hill and I looked up, you know, obviously knew about Rowan. I'm a PCOM grad, so I thought it would be a good fit. And luckily there was a spot open, so I applied. So, yeah.
Awesome. What did you do your residency in? Because you seem like you're pretty fresh out.
Yeah, so I did, I went to medical school at PCOM, graduated 2017. Then I did a pure OMM residency there. I was the only resident there for 3 years and worked, under the famous doctors Nikolai, Alex, and Evan, who are like personal mentors of mine. I helped them revise. Actually, they're coming out, I think, with the next volume of their atlas, and I pretty much I like read through it all during my senior year and helped them like during the COVID times, quarantine, kind of critique things. But yeah, I worked, as a resident there. I did a fellowship in medical acupuncture during my second year of OMM residency at the Helms Medical Institute, which is based out of California, but they do a session each year either in Potomac, Maryland or in Tempe, Arizona. So I did the Maryland session during my second year. So that was cool. And yeah, and then I
What is that?
finished.
Is it like acupuncture related to OMM, or is it just like acupuncture separately?
Funny you say that because so I was one of five DOs out of a class of 40, and I was the only resident. And so coming into the class, there was tons of physiatry, tons of anesthesiologists, even some psychiatrists were taking the course, but almost none of them really had a sense of palpation and like where landmarks were. So the first, session of the class was like how to find landmarks and how to find points on the body. And it was like cake. Like I was, helping almost like teach at that point because doing an OMM residency, it's like I just can, blindfolded figure out where things are. And it was great because, and the reason why I thought it was interesting you mentioned OMM is because once you learn a lot of acupuncture, you see the overlap in terms of what we learn osteopathically. And it's essentially a different language describing similar phenomena. So, like, I was talking with Dr. Hoffman this morning actually during lab. So, Chapman's points, for example, when you start to get into acupuncture treatments, you actually find a lot of the Chapman's points overlie acupuncture meridians. And oftentimes I find a Chapman's point rather than treat it manually. I'll just put an acupuncture needle in there and kind of connect the dots up and down the body. And you find, really interesting correlations with the person you're treating, both spiritually, emotionally, and those qualities of the points, along with their somatic findings and their visceral findings. That it's all this really complex spider web of you know, it's a really beautiful system, honestly. Like, how AT still had a lot of divine inspiration for what he was doing and creating osteopathy. Well, once you learn more languages, for example, acupuncture, Eastern medicine, Ayurvedic medicine, osteopathy, even I've read about rolfing, all these different things from these different thinkers. Um, they're just different languages to describe the same system. And when you learn more languages, you get a better sense of that and how to influence the system.
Right. So
Um,
that
yeah.
whole holistic approach, did that kind of lead you towards trying to do osteopathic medicine and OMM in general? Because I know that you mentioned Ayurvedic medicine too. My grandma was
Yeah.
actually very much into that, wrote books on it as well. So I
Yeah.
have a little familiarity with that. But is that generally that whole holistic type of approach? Is that what got you into pursuing, I guess, a DO degree?
I think it was more rather than me pursuing something, it was like that something found me in a way. So my background is very different in that, I had inklings of wanting to be a doctor, in middle school and high school because my mother is she's an MD psychiatrist, but she trained in Korea and came over here. But her father, my grandfather, was an herbal medicine acupuncturist doctor from Korea, trained in like the 40s and 50s. And that kind of influence in my family is something that I am trying to pick up on and rediscover in a way, but interpreted with my own understanding and with the education I've received from a Western angle.
Right.
Um, but I think it's in a way that my whole life has been holistic in the way that I grew up as a trained artist more than really as a scientist, so to speak. So like I give a lot of credence and credit towards subjectivity. A lot of times more so than objectivity, which runs into some problems in terms of academia and science and research. But
Right.
um, I think there's a lot of value that we can take from subjective experiences and consciousness. And this goes back to like my majors were fine arts and sculpture concentration and also a neuroscience major. And so I took my pre-med courses along with my art courses and had to reconcile like, how am I going to combine these things? And then my pre-med advisor was like, have you heard of like osteopathic medicine? I had no clue like what that was. Even in college, like I was like, oh, MD is a doctor. I'm going to apply to MD school. But when she explained it to me, I'm like, oh, this is like a perfect fit. So I went for it. So that's kind of how I found that way.
That's
Gotcha.
pretty
And
cool that you like have studied so many different types of medicine. I mean, for me
Hmm.
especially, when I like began to learn like osteopathic manipulative medicine and things like that, um, I wanted like with any sort of drug, whenever you administer it to a patient, you see it in your clerkship years, you
Hmm.
see some sort of like tangible result.
Yeah,
Whereas for OMM, you see those tangible results in different ways. So like
totally.
what do you go about, how do you go about measuring those results through like OMM, through Ayurvedic medicine, through different things that you've learned?
I really, I talked to the patient about it. Like, a lot of the results can be intangible in a way, but once you get that patient's acknowledgement of like, oh yeah, like I really didn't have that same experience of pain after the last set. Sometimes they don't realize it until you like have them actively think of what changed. And even the act of thinking of the change can elicit change in itself. So I think it's really important to get to know your patient pretty much. And like, it's unfortunate because of the time constraints in current, medical practice that a lot of times, practitioners aren't able to get to know them as well and read them as well. And just see the diagnosis and label that as their patient rather than see their patient and think of the diagnosis they may carry. Um,
right. Sorry
yeah.
to interject.
Oh, yeah, yeah.
Do you have any success stories that you can share of did this technique on them, they felt radically better, or maybe over time they relieved any chronic pain or anything like that?
Yeah, I mean, I think there's a whole spectrum of what you can deem as like a success story, right? So of course there's like your 20-year-old baseball player, was swinging his bat too much, got a rib out, and you HVLA it back in, and he's fine, and he like doesn't need to see you for another month or two. Um, but then you have these really, really intense, complex patients who can sometimes drain you, but in the long run, they become your much more consistent and deep level patients. For example, a lot of fibromyalgia patients who I've seen, C fiber neuropathy patients who like are at a dead end. No meds are helping them. They have a very sensitive system, so even taking medication in itself can lead to a lot of side effects that they don't like. In those patients, it's like OMT is the one thing that they found to help them. And
Right.
even just coming into the office and talking with them and like being the physician that they can kind of like more kind of voice their experience to, I think is where a lot of the benefit comes from. because like a lot of their pain physicians, even the physicians are burnt out, right? They see all these chronic pain patients. It's really difficult. They're managing a lot of meds, a lot of, Oxy and Percocet and all these meds that, are not fun to manage. And they just hear a lot of like, stressful and anxious patient, stories and complaints and things. But I really like the patients who come to see you because they've been to the five specialists and like no one can quite connect the dots. But like because of what I do, it's almost like I'm specializing in the complete opposite of rather than a sub specialist. I'm like a specialist in like how holistic can I interpret their picture and their pathology and how does everything relate and how do we address that as like this
Now,
whole
going
wellness
off
plan.
that,
Yeah. Yeah.
if do you think that OMM would be more helpful if it was like a first line of therapy? Because
100%.
it's 100%. I mean, that's how I would think about it too, because if it essentially costs $0 to the system, besides the physician like doing OMM, there's no real other cost associated with it. And it's like, if it works, it works. And if it doesn't, maybe we can move on to something else. Do you think that's like the direction that medicine should be going?
I definitely think so. And I think there's a misperception of the cost being time. Where to be quite honest, like if you're efficient in terms of like, let's say uh, you're just chatting with the patient, you can have a hand on their shoulder and literally be doing like a release on their levator scaph, right? And while you're talking about their shoulder pain, or like you can overlap with some of these things. And I think a great example is in the Amish population. I, did a month with Dr. Boyer, who I believe she was Rowan faculty for a bit. She's a Rowan grad out in Lancaster. She has her own practice, integrative med practice. She does a ton of ONT, and their first their first initial go-to for anything is OMM. Like, and they'll even preemptively, once their kid has a growth spurt, they're like, oh, they need a treatment, so they'll bring them in. And yeah, sure enough, they're all they're all misaligned because they're in this crazy growth spurt and like they're jumping off of barns and falling and hitting their heads and stuff. Um, but I mean, I know for like my family and my kids, I'll be treating them a lot because it can just help avoid so many things down the road. And the way I think of a lot of musculoskeletal issues um, is that it's like that butterfly effect, right? Where it's like just some small aberration or misalignment or some traumatic injury that doesn't seem so big eventually throws out the chain up way up and down. And then if untreated, like I've felt so many untreated traumas, I'm like, man, if they had seen a DO for 3 treatments after that car accident, they wouldn't have had to get that cervical fusion 10 years later because it's just
Right.
that small thing that throws a wrench in it. So I absolutely think, it's underutilized. However, I mean, my goal is to try and revitalize that initial thought of like, wait a second, there's something I can just do here real quick. And like maybe that will help save a lot of both cost and suffering down the road.
Right. I
Yeah.
think to go back to something earlier you said, I think you were talking about like, for example, an athlete that you helped treat.
Hmm.
So how do you think OMM plays a role in athletics specifically?
Yeah, I mean it's a huge staple for athletes in terms of getting some kind of body work. So what's interesting in the athletic world is one athlete, like let's say it's an NFL player, they're gonna have a chiropractor most likely. They'll have their ortho surgical team. They'll probably, at this day and age, have an acupuncturist. They'll have a massage therapist, and that'll be the typical team. However, people who I've trained under and I myself have taken the role of like three of those people, right? So like I can just about do everything that the acupuncturist, masseuse, and chiro can do, and have the eyes of that ortho surgeon if things get really serious. Though I can't do the surgery, I know when things are indicated. So um, you're definitely seeing more of a need or more of a demand, I would say, from these teams. So like for instance, um, the Sixers, I was in some talks with them about maybe treating their players, and that's because the head manager for their, massage kind of manual division, they're coming from Europe, and they were like, "Oh, we need an osteopath. Where can we find an osteopath?" Granted, they didn't, say osteopathic physician, which we are. They were just thinking in terms of we need someone who can think like an osteopath, right? Or think in terms
Right.
of structure, function, interrelatedness, and all that good stuff. So, um, all athletes, once they get to high school, I would say, is when they start to seek out some kind of body worker or some kind of manual therapy, which I think is definitely necessary.
Nice.
I mean, that's true. I feel like even I ran like high school cross country, and
Yeah.
I would have that would have been awesome to have like a massage therapist like kind of like stretch me out after really long runs and things like that. But I know I saw on your Instagram that you're super into like physical fitness and exercises and bodybuilding and stuff like that. Do you think that being into that kind of realm of exercise makes you a better physician or a better physician suited to helping these types of patients like athletes?
I think you learn, at least I learned by experience. So, like, I've hurt my own back deadlifting before. I know what that feels like. I've I've done a lot of work with various methods of training. Um, I've experimented with nutrition protocols, with so many different things over the last, I would say, since I was like 19 or so. Since I really started to train pretty consistently. So I'm 32 now, so I'm bad at math. But anyway, that's a few years. And personally, like if I was a pathologist, maybe not, or radiologist or what have you, but like because of what I do is so involved with motion and physicality, I essentially look at being an OMT provider as like a martial arts physician who rather than trying to hurt someone is doing the opposite, right? But it's still very, very physical in terms of your own biomechanics, not injuring yourself when you're manipulating. Um, and a surgeon's going to have a surgeon to be a good surgeon, you need a sharp scalpel to perform the surgery well, right? So I believe if I'm not in, a solid physical condition to provide manipulations using my own system, then I'm not quite treating the patient as well as I can. And I've known a lot of old-time DOs who have injured themselves pretty severely because they have become decompensated themselves and haven't quite kept up that healthy lifestyle, or, they don't have to go crazy with like, you know, doing Olympic weightlifting 5 times a week or whatever, but I think it is important to practice what you preach, for a lot of your patients. Like, you don't want to be that like obese doc who's like, oh, watch those carbs, like, and they're gonna be like, likewise, man, like, you know what I mean? So, I
Fair.
think it's important, and I think it's what's really cool about DO students is I feel like they are very unique in that most DO students are very knowledgeable and like to exercise and move, which I think is super refreshing because I like talking about that stuff. So
Yeah. So, speaking of other things you do outside of being a doctor and OMM and whatnot, so I guess you could tell us more about these paintings you have behind us. How'd you get into?
yeah, this is like kind of my makeshift studio. But yeah, so I actually sell art on the side in terms of private consultations and through this art store called Modern Republic. They're like um, what's the term they use? It's not like a thrift store, but they get, yeah, it's like a dry goods store. Well, they'll find mid-century modern furniture and bring it into this one display area. So like I provide art for them as well, but it's like a fun like side thing. I try and I should get back into it. I haven't since I started. Just been busy,
Right.
um, but yeah, art has been a constant since I was like 3. And I was actually in college thinking of getting my MFA in New York and becoming a professional painter, uh, and then applied to med school. So but I still like to do things on my own, and I, sell my work and have gallery shows and what have you. But it's just a nice, like, complete 180 from, you know, what I do for a living. So it's uh it's my creative outlet for sure. But I use the same kind of mode when I'm treating people with OMT and acupuncture. It's like a similar part of my brain, I think.
Yeah, so you think like parts of medicine kind of bleed into your artwork a little bit?
I would say so, especially in terms of like movement and how I interpret like uh, shape and form and like sensation and like there's a lot of palpatory and fine motor uh, coordination that goes into painting, obviously. And the same goes for palpating and doing like cranial osteopathy, right? You have to be very in tune with your hands. You can't get too much in your head. You have to kind of get into a meditative state and just like feel what you feel and go with it sometimes. And same thing goes with art. Like if I'm stuck on a painting, it's because I'm thinking too much. Um,
Right,
so
right. You
it's
just got
and the same
to
goes for yeah, like biodynamic osteopathy or cranial osteopathy. So that's when things get kind of weird. So it's all
make.
fun. Yeah.
So I guess we can move on to. I'm sure you have a lot of advice for us students, us naive students. So if you were to say, if you were to like just judge how medicine's going now, I know you recently started, but I'm sure you have a very different perspective than we do. What do you think that we should look out for as future doctors?
I really think that two things are knowing yourself. Um, I feel like people need to start meditating more, getting more inside rather than being so outwardly focused. And it's hard because there's so much like stimulation and so much like dopamine hacking in our society right now. But like um, knowing yourself is important because then you can know how you can help other people the best. Because, yeah, I'm an OMM physician and that's what I do, but that's because it's what I love, what I know I'm good at, and what I don't get tired of doing. So it's like to find out your path, you have to kind of put on your blinders, shut out what some of your closest friends and family are telling you to do because they know you, but like they're not you. You know what I mean? So um, obviously, I took the route less traveled compared to a lot of people, but like there's not a single day that I regret, going my path because it's like I've loved every day of it. And I can't believe I honestly get paid to do what I do because I love it so much. And it's like I would volunteer to do this stuff. So
Right.
it's you got to find the thing you like related to that. And it could be like a good example is like my friend from college. He ended up going to Cooper. Shout out Cooper. I know that's part of Rowan, right? So he's a radiology resident. I think he's finishing up, but like he's the kid who like had the sickest computer setup with like 8 screens and like the best, like the nicest like secret lab chair, like the bougiest like gamer chair, for his setup, and like he would just be chilling like all day. He just loved. I'm like, dude, like that's what I'm talking about. So, and he's going to be a radiologist. I'm like, that fits him perfectly,
Right.
and he's very meticulous. So he's like not going to miss a single nodule, right? So you just got to kind of double down on what you like, even though other people are telling you whatever. And but yeah, that first step is just knowing yourself, I think.
So do you think meditation played a big role in that? Because my dad has been preaching that to me since a young age as well. I mean, I think it helped me a lot during quarantine, especially. Um, and then I
Yeah.
got into it a little bit more because of that. Do you think that like, helps you clear your mind and think straight?
Yeah, I started meditating so I got interested in it because of my neuroscience major back in like 2009 is when I really started to like read a lot about the research and methods and approaches. I like Vipassana, insight meditation, but like there's metta, there's like so many different kinds. I experiment with metta a little bit, but yeah, I would say it really helps because um, it really balances out. Here I'm thinking osteopathically, right? It's very parasympathetic, right? You get in touch with your diaphragmatic breathing, thinking of the vagus nerve, thinking of harnessing your own parasympathetics and controlling your autonomics. If anyone's interested in autonomic control, look up Wim Hof breathing. He's like the guru of, autonomic control. And because once you control your own base level nervous system, you can control upper levels of your nervous system, meaning like your thought patterns and like bad habits you have and addictions you have. And with the ability to control your nervous system comes the ability to control your behavior and what you do in life and like your outlook. So I for sure think meditation is like foundational practice that can help people control so many things. And this gets back to like seeing your patients who have anxiety, depression, and all these things that we just throw medications at.
Right.
Um, but like, have they really taken a good shot at trying to meditate every day for 10 minutes for like 4 weeks? I doubt it. You know what I mean? And so
Definitely.
again, it comes into and this interplays back with like what we're teaching our kids, right? In like PE class, why aren't we teaching our kids how to meditate at an early age? Like
Right.
uh, like my fiance over here, she actually her like education early on was going to a Buddhist temple with her grandmother and like meditating. And sometimes I wonder, I'm like, honestly, that would have benefited me way more than going to like a preschool or kindergarten class where you just color in the lines, right? So it's like
Yeah.
I think it's a very good tool to start picking up on. There are a lot of great apps out there. I've tried Headspace. I like Waking Up with Sam Harris. He might have changed the name of that app. Um, but then you
Yeah. No.
develop your own practice. Yeah,
Yeah.
and
I've listened to Sam Harris a little bit too, and
yeah, he's
I
interesting.
a lot of people use the Headspace Calm app too. I think I've
Calm.
heard.
Yeah,
Yeah,
Headspace is pretty useful. It's just
yeah,
like you're kind of stuck with whatever they have, though. You can't really go about it in different
exactly.
ways unless you like scroll
That's why
through
like
and figure it
Insight
out.
Timer is really good. Insight Timer is more freeform. You can just have a simple timer, or you can follow people on there. But yeah, you develop your own practice, and I'd say nowadays I do about 10 minutes of meditation a day minimum. I was up to an hour a day, I think, back in the peak of the pandemic because I had nothing to do.
Right.
Um, and it definitely like helps chill you out for sure. So it's just a
Oh yeah,
parasympathetic
definitely.
boost. Yeah, that's how I think about it.
Do you think, I mean, since you're a new professor at like Rowan for OMM, do you think meditation or do you have any like suggestions that you want to make to the curriculum in terms of like directions that we're going to take OMM teaching or any sort of
Yeah.
teaching?
And this is something I want to talk to the department about, but I'm going to be the second, or I guess I am now, the second year class coordinator, at least for SGL. So thank you,
Hey,
thank you.
congrats.
Yeah,
Congrats.
thanks. I don't know if I'm ready yet, but I said yes. So,
We'll see you
but I
next year.
think one really cool thing would be, and I get questions about this stuff all the time, is like, what is acupuncture? What is cupping? What are these integrative modalities that are out there? And like, just how are they working on the body mechanistically? And I think that is going to be something more common we're going to see is these integrative modalities. So I would like to do like an integrative OMM lab, just at least showcasing. Like I'm not going to teach you guys how to do acupuncture, but at least like I can maybe demo it or talk about it, show you the needles, show you guys like the thought process and the language behind it. You're going to see cupping a lot too. That's something that's like coming in trending, and something that I do pretty frequently. So I think maybe having more of an integrative approach to OMM, a lab like that, because I just naturally get questions about it, because students are always curious, and it's something that as a DO and as someone who uh, thinks and gets patients that are more holistically minded, you're gonna get questions about it. So might as well educate you guys on like what at least the acupuncture mechanism is or thought to be. You know what I mean? So that's something I was thinking of. I have to discuss that with the faculty, and we'll see.
I
That
feel like
makes
that's
sense.
pretty cool because like a lot of people, like you said, like a lot of people have questions, including myself. But I feel like, do you think that stuff needs to be like mandatory in the curriculum or optional? Because I know a lot of people that
Yeah.
are just here like, you know, they want to learn the medicine and they want to get out. But then I know a lot of people that are like, hey, I want to learn more about osteopathy and how do
Mhm.
DOs think differently and like what can we do that's special akin to us, you know?
Yeah, I think it would be a good, maybe like something optional that if you're interested, like, I'll be here if you want to pick my brain about like acupuncture setups or like how to both treat with OMT and acupuncture, what that even looks like. Because when I saw that as a student, I was like, oh, so I'm gonna do that. Like I was like, I'm all in. This is how I'm gonna treat because it just does things that you like couldn't even imagine like people do. Like I've just got a lot of stories of crazy turnarounds with it. So I was like, yeah, I want to learn that because it's like a skill you can master. It's not like a pill you can write for. And like
Definitely.
I really like Jedi, so I'm like I want to be one. You know what I mean? So
That's pretty
Well,
cool.
I think I don't want to take up too much more of your time. But just wanted to say thank you for coming on. I think you gave us a very broad range of advice and interesting topics for sure that I think are not discussed as much in medicine as they should be. So I really thank you for coming on. Richard, if you want to say anything.
Yeah, no, I mean, it's awesome because like you're going to be our OMM course coordinator for next year, and like it's cool to see how you're going to be thinking about things in terms of like manipulation, in terms of like alternative treatment, things like that. So thanks for sharing all that you've shared, and it's been a pleasure, and thanks for coming on.
Yeah. Thanks, guys. I'm excited to meet more of your class. And, if you ever need anything, just email me or hit me up. It was
Awesome.
great.
All
Awesome.
right.
Thank you, Dr. King. Take it easy.
Thank you.
Yeah, no
We'll see you
worries.
soon.
All right. See ya.